Between 1975 and 1998, a quiet doctor in a northern English town carried out one of the most prolific killing sprees in modern history. Harold Shipman, a trusted general practitioner, murdered an estimated 215 of his patients, possibly more. His weapon wasn't a gun or a knife. It was trust and morphine. Shipman's victims were almost always elderly women, often living alone. He would visit them under the guise of routine care, administer a fatal dose of diamorphine, and then calmly record the cause of death as natural. Most families suspected nothing. He was a doctor, respectable, composed, reassuring. No one questioned the paperwork. The pattern continued for over 2 decades. But in 1998, one death stood out. Kathleen Grundy, a healthy former mayor, died suddenly, and her new will left everything to Shipman. Her daughter, a solicitor, grew suspicious. An autopsy revealed a massive dose of heroin in her system. It wasn't pain relief, it was execution. A deeper investigation began. Police reviewed hundreds of patient records. They noticed a clear pattern. An abnormal number of deaths occurred in Shipman's presence. Most patients were found fully clothed and seated upright, often during supposed home visits. There were no emergency calls, no attempts at resuscitation, just silence and paperwork. Shipman was arrested and tried in 1999. He was convicted of 15 murders and 1 count of forgery, though further inquiries suggested he'd killed over 200 people. He received a life sentence without parole and died by suicide in prison in 2004. Psychologically, Shipman did not fit the popular image of a serial killer. He was a family man. He held a respected job. But behind the calm exterior lay a disturbing detachment. He showed no remorse, no emotional reaction, only a desire for control. Some believe he had a god complex, taking life at will, hidden beneath the routine of general practice. The case exposed massive failures in oversight. There were no effective checks on death certificates, no centralized monitoring of controlled drug use, and little scrutiny over the power a GP could wield. The Shipman inquiry led to sweeping reforms across the UK's medical and legal systems. But the damage was already done. Harold Shipman had redefined the limits of betrayal. His case remains one of the most chilling reminders that even the most trusted professions are not immune to monstrosity, especially when that trust is never questioned.